Hi, I'm Dr. Allen from Jones Animal Hospital. Thanks for joining us today for Vet Visits. The topic today is something I hope you never have to deal with, but unfortunately it's a fairly common thing to see in middle-aged and older dogs and cats, and that is cancer. Cancer is a word that strikes fear and a great deal of anxiety in most of us when we worry about that with our pets, but it's something that we're seeing a lot of, and I don't know that we see any more than we've seen in the past, but we're recognizing it better. We also, though, have better ways to treat it and take care of it, and many animals are living much longer and have much better quality of life than they would have had in years gone by with cancer. Cancer comes in a wide variety of presentations. Cancer is just actually a very generic word that just means an abnormal growth of cells. So any abnormal growth of cells is cancer. Now, cancer in general is divided into two broad categories. Benign cancer, which is one that's likely to sit still, not spread very rapidly, not invade deeply, and just be pretty quiet. The opposite of that is a malignancy. Malignancies tend to grow fairly rapidly. They tend to invade the tissue around them, and they tend to spread to other parts of the body. Now, it's not just black or white, benign or malignant. There's a long spectrum, long gray area in between the two. So there are degrees of malignancy, and some are more or less malignant than others. Cancers also can affect any part of the body. We see cancers that affect the bone marrow, cancers that affect all the different organs, see cancers that infect the bones and skin. We occasionally will see cancers in eyes. There's lots of different places you can find them. So what does cancer look like? Because it can show up in any organ, it can look like a great deal of different things. Everything from an obvious lump or bump to an animal that shows up very anemic and has a problem with the bone marrow, to an animal that has a distended or bloated abdomen that has a large abdominal tumor, to an animal that's having gastrointestinal issues and turns out it has cancer in the stomach or in some part of the small or large intestines. So it can look like a great number of things. And it sometimes is very simple to diagnose and realize where it is and what it is exactly. And sometimes it can be very subtle and require a lot of lab work, x-rays, ultrasounds, advanced imaging like CAT scans or MRIs. Sometimes we don't diagnose it short of an exploratory surgery to go in and take biopsies. So a cancer can be quite involved to find. What can we do? Some cancers are isolated and solitary and are very straightforward just to remove. And if you can get good clean margins, which means have normal tissue all the way around your surgical site, you have a good chance of getting rid of it and be done with it. Some types of cancer, when we see them, they've already spread to other parts of the body. And that's a different stage. You have stage 1, which is just right in one place. Stage 2, which is in local lymph nodes. Stage 3, which is going to lymph nodes a little further away. And then stage 4, which has disseminated or spread over the entire body. So kind of depending on where the pet is in the staging process determines what can be done to help take care of it. Surgery is one option, and we already talked about that. Chemotherapy is also used, and many times people have bad connotations about chemotherapy because we always think about people who have had chemotherapy and they have severe gastrointestinal signs, they lose their hair, they feel really bad, and that kind of thing. And we see that occasionally in animals, but very often our goals with chemotherapy in animals are very different than the goal in people. In people, the goal is always to cure the cancer, which is what we need to do. And in people, we have very highly trained oncologists who have a lot of experience with different chemotherapy protocols who do a lot of good. In animals, we're almost always just aiming for remission rather than for cure. And remission means you cause the cancer to shrink or to go away, but we always realize that that's going to be a temporary thing and it's going to come back at some point. But the trade-off here is the chemotherapy protocols that we use tend not to make them very sick, and most of them come through and never miss a meal and maintain a very good quality of life. And very often with appropriate chemotherapy, an animal with cancer can have 6, 12, 18, sometimes 24 months of additional good quality of life. So cancer in animals can look like a lot of different things. It can affect many different organs, can be very simple and easy to identify, or be very subtle and require a great deal of diagnostic work to identify. All cancers require a biopsy, which is where you take a tissue sample, send it off to a pathologist where they make microscopic slides, examine the cells, and then tell us exactly what that cancer is. And then once we have that information, we can make a plan as what's going to be the most appropriate and humane way to go with this particular pet to take care of its situation. So anytime you find a lump or bump or something that just doesn't seem right, have your veterinarian check it out. It may be nothing, or it may be something that needs to be done. As with most things, addressing cancer early gives you a much better chance of a good outcome than if it's been going on for some time before you begin to address it. I hope you never have to look at this, but most of us have animals all of our lives. Most of us have had multiple animals all of our lives, and sooner or later the percentages catch up with us, and we have to deal with one of our pets having cancer. And having a effective and humane plan and keeping quality of life as the very first thing in our mind, we can oftentimes give our pets additional quality time even with cancer. Check with your veterinarian. They're your best source of information. I'm Dr. Allen at Jones Animal Hospital. Thanks for joining us today on Vet Visits.